So this is my final project. It's on physical therapy. It's what I am going to be doing and studying. So that's introduction. Scope of the practice. So the scope of physical therapy is for mainly rehab and the promotion of physical function. What physical therapists mostly do is help patients recover from like injuries or help them become more mobile in everyday activities. And physical therapy is mainly for all patients of all ages who have injuries, and for people who also are like elderly and have trouble moving and that kind of stuff. And physical therapy is a very big component on healthcare. It's really important because a lot of people are getting injured nowadays, and the elderly population is rising. So it's super important to have physical therapists. They're in high demand because of the high population of elderly from baby boomers. And rehabilitation helps performance and prevents risk of injury. So whenever physical therapists work on a patient, they always have an end goal of preventing the injury from happening again, and also help the patient even more after the injuries happen, so that they know the knowledge of the anatomy of their body and how to prevent this from further happening. So scope of practice continued. The practice involves three factors that we practice by. It's professional, jurisdictional, and personal scopes. So first, professional scope is the practice that is involved with a wide range of knowledge, supported by an educational process and based on evidence. And then a jurisdictional scope involves practicing under the state laws which are given to you. It depends on the state. Every physical therapist, like in different states, have different laws that they can go by. So, for an example, in I think it's Connecticut and Kansas, they're allowed to use Graston on their patients, but in Florida, they're not allowed to use Graston because different laws are indicted in the states that you can practice in. Next is who will you be interacting with while you're working. So physical therapists work from pretty much everyone. So work with children to elderly patients. It depends on where you work that what kind of people you'll be working with. So for example, in a nursing home, you're going to be working with mainly and obviously mostly elderly patients. And then if you're working in a pediatric facility, you're going to be working with children. And if you're in a sports facility, you're going to be working with young adults to teenagers who are in competitive sports and have injuries, whatnot. So next is the daily duties of a physical therapist. So typically the duties of a physical therapist are examinations, diagnosing people with what kind of injuries they have, a plan of care, and usually like the examinations involve doing different types of balancing and core strengthening activities and trying to figure out what the main issue is and to resolve it. So usually it's the testing of muscle function, strength, flexibility, range of motion, balance, motor function, and aiding in everyday living. So what physical therapists do is to help the patient get to that that level that they were at before the injury started, and to get them to be doing what they usually do without any pain or any any blockage of what they should be doing. And there's different therapies you could give your patients. There's electrotherapy, there's mobilization therapy, there's exercise traction, motor learning. These are different therapies that they give to the patients depending on what kind of injury you have. So, for example, if someone had a leg injury or a lower back injury, what they'll give to the patients is balancing activities. So going on maybe on a yoga ball, and they make them stand on it for a couple seconds and switch the legs off. And this is what when I was shadowing at multiple outpatient clinics, I saw this for myself. So who supervises physical therapists? Well, physical therapists are a doctor of physical therapy, so they don't really have anyone actually supervising them. They have, the state making sure that they abide by the laws, and they do have a lot of independence with their practice, so they can open their own practice, and they have physical therapists, assistants, and interns, and shadowing people underneath them to work with them. So physical therapists supervise other people. So work setting, mainly it depends on where a physical therapist works at. You can work from a hospital to an outpatient clinic to a rehab hospital to a home care to school-based to corporate and athletic training centers. What I would want to do is work at an athletic training center because it's more of my scope of what I want to do, so it has the facility needed. But you can also, it depends on where you want to work, you can have the freedom with physical therapy to work at any of these places listed to work at. So timeline, what I'm going to be doing is in year 1, which is now, attend summer school, graduate USF by the summer, after summer school, and then apply for physical therapy school during that time. Year 2 is when I will be attending physical therapy school, and then while in PT school, you gain experience from the internship. And then year 3 is you take your board examinations, you take your licensure exams, and you also attend clinicals while you're in school for more experience in physical therapy. And then year 4 is graduate physical therapy school and apply for jobs in sports physical therapy and outpatient clinics. If sports PT doesn't work, I would want to do either pediatrics or work in just a regular outpatient clinic. And then year 5 up here is get a job that's desired, which is basically what I said, and then have all certifications and licenses to practice physical therapy. And then educational requirements is Doctor of Physical Therapy degree. You need that to practice in the state and anywhere. 3 years of the program you get accepted into. Courses I'll be taught usually are your prerequisite courses that you also took in college. And then most physical therapy schools require being accepted in a bachelor's degree before being accepted. And with all this, you'll need a certification through the American Board of Physical Therapy Specialty. And you also, while you're in the program, you could do an internship or clinical residency, which is very important so that you are more looked into from jobs and schools, and it looks good on your resume. So continuing education for when you're a physical therapist is an organization called the American Physical Therapy Association. This lists all the events going on in your area, news, and information more on the topic of physical therapy. And state resources, the Florida Physical Therapy Association, which shows events in Florida and opportunity for PT students. So my conclusion is job searching in the field is not easy for PT or any healthcare field. Even though the job outlook is pretty high, it's still hard to land a good job and a job you want because of the high demand and how many people are doing PT now. It's the biggest healthcare job that people want. It's like greater than any other healthcare job out there because of the salary and because of the freedom and because of the demand of it. And I would want to one day work with a professional team and help athletes recover from injuries and help them play again. And then when you're in PT school, internships are really important. They'll help you gain experience and hours and understanding of how to work with patients and the relationships you can build. And any internship will also make you a better candidate for any job you want. And these are the references, and thank you for